CAR T-cell therapy, is this the future of cancer treatment? For decades, cancer treatment has followed a familiar path. Doctors cut tumors out with surgery, burn them with radiation, or poison them with chemotherapy. These methods have saved millions of lives, but they also come with serious limits. Chemotherapy, for example, cannot tell the difference between cancer cells and healthy cells. It attacks everything, often leaving patients weak, sick, and exhausted. But what if the cure for cancer did not come from an external drug at all? What if the weapon was already inside the patient's own body? This bold idea is no longer science fiction. It is becoming reality through a groundbreaking treatment called CAR T-cell therapy. Turning the immune system into a living drug. To understand why CAR T-cell therapy is so revolutionary, we first need to meet the immune system's soldiers, T-cells. T-cells are white blood cells that patrol the body, searching for danger. When they recognize infected or abnormal cells, they attack and destroy them. The problem is that cancer cells are clever. Because they grow from our own tissues, they often hide in plain sight. As a result, the immune system frequently fails to recognize them as enemies. CAR T-cell therapy changes that by giving T-cells a powerful upgrade. CAR stands for chimeric antigen receptor, and the word chimeric is the key. These receptors are called chimeric because they combine two biological systems into one. One part comes from an antibody, which is exceptionally good at recognizing specific targets. This is the eye of the CAR. It allows the T-cell to clearly see a marker on cancer cells. The other part comes from a T-cell receptor, which sends strong internal signals that activate the T-cell and trigger its killing response. In simple terms, CAR T-cells are given new eyes and a stronger trigger. Most currently approved CAR T-cell therapies target a protein called CD19, which is found on the surface of B cells. Many blood cancers, such as certain leukemias and lymphomas, originate from B cells, and CD19 appears reliably on their surface. Because CD19 is largely absent from vital organs, it makes an ideal target. This specificity is one major reason CAR T therapy has been so successful in blood cancers. Once infused back into the patient, these engineered T-cells actively search for their target, lock onto it, and destroy the cancer cell. Even more remarkably, they can continue multiplying inside the body and remain active for months or even years. That persistence is why researchers often describe CAR T therapy as a living drug. From blood draw to cancer battle, how CAR T therapy works. Although the science behind CAR T therapy is advanced, the overall process follows a clear sequence. 1. Collection. Doctors collect T-cells from the patient's blood, using a procedure similar to donating blood. 2. Genetic engineering. In a specialized laboratory, scientists insert a new gene into the T-cells. This gene instructs the cells to produce chimeric antigen receptors on their surface. 3. Expansion. The modified T-cells are grown into an army of hundreds of millions. 4. Lymphodepletion, conditioning phase. Before infusion, patients receive a short course of mild chemotherapy. This step does more than simply make room. It temporarily reduces existing white blood cells so that the immune system does not reject the incoming CAR T-cells. There is less competition for nutrients and immune signals cytokines. The CAR T-cells can expand rapidly once inside the body. 5. Infusion. The CAR T-cells are returned to the patient through a single IV infusion. 6. Attack and expansion. Inside the body, the CAR T-cells recognize their target, multiply aggressively, and begin destroying cancer cells. From start to finish, this entire process typically takes 3 to 5 weeks, followed by close monitoring in the hospital. A real-life miracle. Emily's story. One of the most well-known CAR T-cell success stories is Emily Whitehead. a young girl diagnosed with acute lymphoblastic leukemia, ALL. By age 6, Emily had relapsed multiple times. Chemotherapy failed. A bone marrow transplant failed. Doctors eventually told her family that there were no remaining treatment options. As a last resort, Emily received an experimental CAR T-cell therapy. The result was dramatic. Within weeks, doctors could not find a single cancer cell in her body. She entered complete remission. More than 10 years later, Emily remains cancer-free. In fact, she celebrated 13 years of remission in 2025. A powerful reminder that CAR T-cells can persist in the body and protect patients for more than a decade. Her case helped convince the medical community that CAR T therapy was not merely experimental. It was a genuine breakthrough. Power and risk. When the immune system burns too hot. CAR T therapy is powerful, but that power comes with risks. The most common serious side effect is cytokine release syndrome, CRS. As CAR T cells attack cancer, they release large amounts of chemical signals called cytokines. This sudden immune surge can cause high fever, low blood pressure, breathing difficulties, and stress on vital organs. Importantly, CRS is often a sign that the treatment is working. It indicates that the immune system has fully activated. Doctors sometimes describe CRS as a fire, necessary to destroy cancer, but dangerous if it spreads too far. To control severe cases, physicians often use tocilizumab, a drug originally developed to treat rheumatoid arthritis. Tocilizumab blocks one of the main inflammatory signals, allowing doctors to turn down the heat without shutting off the CAR T cells themselves. Another serious risk is ICANS, a form of temporary neurotoxicity. Patients may experience confusion, difficulty speaking, tremors, or seizures. In most cases, these symptoms resolve with appropriate treatment, but careful monitoring is essential. Because of these risks, CAR T therapy is performed only in specialized hospitals, with highly trained medical teams. Why solid tumors are still so difficult, the 3 barriers. Despite its success in blood cancers, CAR T therapy has struggled against solid tumors such as lung, breast, or pancreatic cancer. Researchers often describe this challenge as climbing 3 major walls. 1. The physical wall. Solid tumors are dense and tightly packed. Their supporting tissue, known as the stroma, acts like concrete, making it difficult for CAR T cells to penetrate the tumor. 2. The metabolic wall. Even when CAR T cells reach the tumor, they encounter a hostile tumor microenvironment. This environment is low in oxygen, acidic, and filled with suppressive signals that effectively turn off immune cells, leaving them exhausted and less effective. 3. The antigen wall. Finding the right target is perhaps the hardest challenge. Unlike CD19 and blood cancers, most solid tumors lack a protein that appears only on cancer cells. Targeting the wrong protein risks damaging healthy organs, a dangerous effect known as off-target toxicity. Overcoming these 3 barriers is now one of the most active and promising areas of cancer research. The elephant in the room: cost and access. CAR T-cell therapy is not only complex, it is expensive. Current FDA-approved treatments can cost $375,000 to $500,000 per infusion, not including hospital stays and follow-up care. Because each treatment is custom-made for a single patient, it is difficult to mass produce. This is why researchers are racing to develop off-the-shelf CAR T cells, made from healthy donors rather than individual patients. If successful, these therapies could dramatically reduce costs, shorten wait times, and make CAR T therapy accessible to many more patients worldwide. Beyond cancer, a glimpse of the future. Perhaps the most exciting aspect of CAR T-cell therapy is what comes next. Scientists are now testing similar approaches for autoimmune diseases such as lupus, where the immune system mistakenly attacks the body itself. Early trials suggest that reprogrammed immune cells may be able to reset the immune system, offering long-lasting relief. In 2024 and 2025, early-stage clinical trials reported several lupus patients entering drug-free remission, a result that was previously thought to be nearly impossible. CAR-T therapy may be only the first chapter in a much larger story: the rise of personalized, cell-based medicine. Is CAR-T cell therapy the future? So, is CAR-T cell therapy the future of cancer treatment? The honest answer is, part of it. CAR-T therapy is not a cure for all cancers. It is expensive, technically demanding, and carries serious risks. But it has already achieved something extraordinary. It has cured patients who were once considered beyond saving. More importantly, it has changed how scientists think about medicine. Instead of fighting disease with chemicals alone, we are learning how to reprogram living cells themselves. Cancer has not been defeated, but for the first time, it is being hunted from the inside. And that changes everything.
It's time to study new words in context. 1. Groundbreaking. Definition: very new and important in a way that changes how people think or work. Example: CAR-T cell therapy is a groundbreaking treatment for cancer. 2. Chimeric. Definition: made by joining two different things into one new thing. Example: a chimeric receptor combines parts of an antibody and a T cell. 3. Antigen. Definition: a substance on a cell that the immune system can recognize. Example: the CAR-T cells look for a specific antigen on cancer cells. 4. Receptor. Definition: a part of a cell that receives signals or recognizes something. Example: the receptor helps the T cell find cancer cells. 5. Antibody. Definition: a protein made by the immune system to find and fight harmful cells or germs. Example: antibodies help the body recognize infections. 6. Specificity. Definition: the ability to focus on one exact target and not others. Example: CAR-T therapy works because of its strong specificity for CD19. 7. Persistence. Definition: the ability to continue for a long time. Example: the persistence of CAR-T cells helps protect patients for years. 8. Lymphodepletion. Definition: a medical process that lowers certain white blood cells before treatment. Example: patients receive lymphodepletion before CAR-T cell infusion. 9. Nutrients. Definition: substances in food or the body that help cells grow and stay healthy. Example: cells need nutrients to survive and multiply. 10. Acute. Definition: very serious and happening suddenly. Example: acute leukemia develops quickly. 11. Lymphoblastic. Definition: related to immature white blood cells called lymphoblasts. Example: acute lymphoblastic leukemia affects young white blood cells. 12. Relapsed. Definition: the recurrence of symptoms or a disease such as cancer after a period of remission or seeming recovery. Example: the patient relapsed after 2 years of remission. 13. Resort. Definition: a final choice when nothing else has worked. Example: CAR-T therapy was used as a last resort. 14. Remission. Definition: a period when the signs of a disease are gone or greatly reduced. Example: the patient entered remission after treatment. 15. Breakthrough. Definition: an important discovery that makes big progress possible. Example: CAR-T therapy is considered a major medical breakthrough. 16. Tocilizumab. Definition: a medicine used to reduce strong immune reactions and inflammation. Example: doctors use tocilizumab to treat severe CRS. 17. Neurotoxicity. Definition: damage or harmful effects on the brain or nervous system. Example: some patients experienced temporary neurotoxicity. 18. Pancreatic. Definition: related to the pancreas, an organ that helps control blood sugar and digestion. Example: pancreatic cancer affects the pancreas. 19. Stroma. Definition: the supporting tissue around a tumor or organ. Example, the stroma can make it hard for immune cells to enter a tumor. 20. Metabolic. Definition, related to how the body or cells use energy. Example, the tumor has a metabolic environment that weakens T cells. 21. Microenvironment. Definition, the small surrounding area around cells, including nearby cells and conditions. Example, the tumor microenvironment can block immune cells. 22. Acidic. Definition, having a low pH level, slightly sour in chemical nature. Example, the tumor environment is often acidic. 23. Off-target toxicity. Definition, harm that happens when a treatment attacks healthy cells by mistake. Example, scientists work hard to prevent off-target toxicity. 24. The elephant in the room. Definition, an obvious problem that people avoid talking about. Example, the high cost of treatment is the elephant in the room. 25. Off the shelf. Definition, ready-made and available for general use, not specially made for one person. Example, researchers are developing off-the-shelf CAR T cells.
Comprehension questions. 1. What traditional cancer treatments are mentioned at the beginning of the article? Answer: surgery, radiation therapy, and chemotherapy. 2. Why is chemotherapy described as having serious limitations? Answer: because it cannot distinguish between cancer cells and healthy cells, so it damages both. 3. What is the central idea behind CAR T-cell therapy? Answer: it uses a patient's own immune cells, genetically reprogrammed, to recognize and destroy cancer. 4. What role do T-cells normally play in the immune system? Answer: T-cells patrol the body to find and destroy infected or abnormal cells. 5. Why do cancer cells often escape detection by the immune system? Answer: because they grow from the body's own tissues and can hide in plain sight. 6. What does CAR stand for, and why is it described as chimeric? Answer: CAR stands for chimeric antigen receptor, and it is chimeric because it combines parts of an antibody with parts of a T-cell receptor. 7. What are the two main functions combined in a CAR receptor? Answer: recognizing cancer cells from the antibody part and activating the T-cell to kill them from the T-cell receptor part. 8. What is CD19 and why is it an important target in CAR T therapy? Answer: CD19 is a protein found on B cells, including many cancerous B cells, making it an ideal target for blood cancers. 9. Why is CAR T-cell therapy often called a living drug? Answer: because the modified T-cells can survive, multiply, and continue protecting the body for years after treatment. 10. What is lymphodepletion and why is it done before CAR T-cell infusion? Answer: it is mild chemotherapy that reduces existing white blood cells to prevent rejection and help CAR T-cells expand more effectively. 11. How long does the full CAR T-cell treatment process usually take? Answer: about 3 to 5 weeks, followed by close hospital monitoring. 12. Who is Emily Whitehead and why is her story important? Answer: she is a leukemia patient whose cancer went into remission after CAR T therapy, demonstrating its life-saving potential. 13. How long had Emily Whitehead remained cancer-free as of 2025? Answer: she celebrated 13 years of remission in 2025. 14. What is cytokine release syndrome, CRS? Answer: a serious immune reaction caused by the rapid release of cytokines when CAR T cells attack cancer. 15. Why is CRS sometimes considered a positive sign? Answer: because it indicates that the immune system is strongly activated and the treatment is working. 16. What medication is commonly used to treat severe CRS? Answer: tocilizumab. 17. What are the 3 main barriers CAR T therapy faces in treating solid tumors? Answer: the physical barrier, dense tumor tissue, the metabolic barrier, hostile tumor microenvironment, and the antigen barrier, lack of cancer-specific targets. 18. What recent development suggests CAR T therapy may work beyond cancer? Answer: early trials in 2024-2025 showed some lupus patients entering drug-free remission.